Bismillahirrahmanirrahim. And let's start today's presentation with the message from WHO. The message is health is a human right for everyone at every age. Today's my topic of presentation is Shistosomiasis. In this presentation, we will cover introduction, epidemiological determinants, clinical manifestations, levels of preventions, and recent advances. And by the end of this presentation, we would be able to understand about pathogenesis, diagnosis, treatment, and prevention of schistosomiasis and the national and global updates about it. Here is a pictorial presentation. You can see on the left column is the parasite itself, and in between is the snail, which is intermediate host, and the right side is the child, that's human, the ultimate host. Let's start with the introduction. Schistosomiasis is a parasitic disease characterized as either intestinal or urogenital. It depends on where the adult flukes are located. I mean, if they are located in the intestine or whether they are in urogenital system. So these are characterized by their, the location. Four species are can cause intestinal schistosomiasis. These are Schistosoma intercalatum, Schistosoma japonicum, Mansoni, and McKenzie, while Schistosoma hematobium causes urogenital schistosomiasis. Symptoms of schistosomiasis directly affect the body's reaction to the worm's egg. Intestinal schistosomiasis can present with abdominal pain, bloody stool, diarrhea, and in advanced cases, enlargement of liver and spleen may happen. While urogenital schistosomiasis present with the blood in the urine and fibrosis of bladder, ureter, and the kidney damage in the advanced cases. Schistosomiasis remains a public health problem in several parts of the world, particularly in Africa, where 92% of people requiring preventive chemotherapy for this disease live there. In the Eastern Mediterranean region, particularly Egypt, Somalia, Sudan, and Yemen remain the most endemic countries. In 2018, about 20 million people required preventive chemotherapy against schistosomiasis. Disease is considered eliminated in Islamic Republic of Iran, Lebanon, Morocco, Tunisia, while the low endemicity has been reported in Egypt, Iraq, Jordan, Libya, Oman, Saudi Arabia, and Syrian Arab Republic. Schistosomiasis affected many people in developing countries. Its other name for snail is the snail fever and cutaneous schistosomiasis. Although the mortality is very low, but it can be a very debilitating disease. The other name for schistosomiasis is bilharzia rather, or bilharziosis. It has been named after a scientist who described it in 1851. His name was Theodor Bilharz. The key facts about the schistosomiasis is that it's acute and chronic disease by a parasitic worm. People are infected during routine agriculture, domestic, occupational, recreational activities, which expose them to infested water. Lack of hygiene, certain play habits of school-age children, such as swimming, fishing in infested water, make them vulnerable to infection. Schistosomiasis control focuses on reducing disease through periodic large-scale population treatment with praziquantel, which is a more comprehensive approach, including potable water, adequate sanitation, and snail control. These are the other measures we will discuss in a later part of this presentation. It is estimated that at least 290 million people require preventive treatment for schistosomiasis in 2018. out of which more than 97 million have reported to have been treated. Here we go. Yeah, it's the geographical distribution. I mean, according to species, which species are more prevalent and which area. First, the intestinal shistosomiasis, which is caused by the four species, Schistosoma mansoni, japonicum, meckenzie, and intercalatum. And these intestinal somiasis, the geographic area according to each species is different. You can see against mansoni is the more prevalent in Africa, Middle East, Caribbean, Brazil, Venezuela, Suriname, while japonicum is in China, Indonesia, and Philippines. Meckenzie more in several districts, Cambodia and the Lao People Republic. And while Schistosoma guineensis and related Schistosoma intercalatum is more prevalent in the rainforest area of Central Africa. Urogenital schistosomiasis, which is caused by species Schistosoma hematobium, is the geographical area where it is more prevalent is the Africa and the Middle East. While Corsica is in France is also there. It's a simple presentation, simple explanation about the life cycle, a man, ultimate host, and snail, intermediate host to the fresh water from where the snail first get infested and transmitted to a human. Let's see it in detail how it completes this cycle. It starts from the ova, the eggs in the water, it may be of these three species mainly, two of them causing intestinal and one is the urogenital. Two species causing, you can see here, mansoni and japonicum, this causing intestinal, and my hematobicum, it causes urogenital schistosomiasis. The egg hatches releasing Mercedia, the first form of, the organism, and then this Miracidia penetrate the snail's skin, snail tissue, and in snails, the successive generation come out, and the eventual cercaria are released from the snail into water and swimming water. And these cercaria, they penetrate the skin of the human, while penetrating, they lose their tail and become Schistosomia. And while in the circulation, most migrate through the portal blood system to liver and mature in adult. Penetration of the paired adult one migrate to mesenteric, venous plexus of the bowel or liver, while the other form, they finally reside there, venous plexus of the bladder. Again, the more simpler form, how it completes its cycle, human feces or urine, eggs related from snail to cercaria, and penetration of the skin, and the cycle goes on like this. This is the sequence of events what can eventually happen once it's infected a person, eggs inflammation, and from egg granuloma, fibrosis, hepatomegaly, and portal hypertension. And for portal hypertension, splenomegaly, ascites, and esophageal varices may be the eventual outcome. While in the urogenital hematobium eggs, bladder, they attack the bladder wall, and bladder wall become fibrous and increase the frequency of bacterial infection, and eventually may end up in the bladder carcinoma or sterility. And this is the, the globe where the types of prevalence, most of the somiasis cases are there. You can see the both form in the hepatointestinal form are there in the blue, and while the yellow, only urinary showing, while in the green, both types are there. Let's talk about the, in terms of agent host environment. First, the agent morphology. Adult worms are tend to, please switch your, okay, agent, I was talking about the agent first. Agent worms are 10 to 20 millimeter long. These are, I mean, the visible to the naked eye, and the schistosomes have separate sexes. The male has a canal in which the slender female worms reside. In terms of host, there are, as I mentioned, the snail is the intermediate host. And again, for each species, the snail is different also. And for Cystosoma hematobium, the host is Mulinus truncatus, while Cystosoma mansoni, biomorph, biomom Filaria and Alexandria, is what I can pronounce. That's it. It is a host, snail host. Let's talk about infection and transmission. People become infected with the larval form of the parasite, which is released in the fresh water by the snails and penetrate the skin during contact with the infested water. The transmission occurs when the people suffering from cystosomiasis contaminate freshwater source with their excreta containing parasitic eggs which hatch in water. So in the body, the larva develops into adult schistosomes. Adult worms live in the blood vessels where the females release eggs. Some of the eggs are passed out of body in feces or urine to continue the parasite's life cycle. Others become trapped in the body tissue, causing immune reactions and progressive damage to the organs. A bit more detail about the symptom, what they can cause depending upon their location, eventually where they reside. Intestinal cystosomiasis can result in abdominal pain, diarrhea, blood in stool, liver enlargement, or more frequently, depending upon the severity, accumulation of fluid in peritoneal cavity, hypertension of the abdominal blood vessels, and eventually the enlargement of spleen or liver. The classical sign of urogenital cystosomiasis is a hematuria, fibrosis of bladder, ureter, kidney damage, and in advanced cases, the bladder cancer may be the ultimate outcome. In women, urogenital cystosomiasis may present with the genital lesions, vaginal bleeding, pain during sexual intercourse, nodules in the vulva, while in men, urogenital cystosomiasis can induce pathology of seminal vesicles, prostate, and other organs. This disease may have also the long-term irreversible consequences, including infertility. The economic and health effects of cystosomiasis are considerable, and the disease disables more than it kills. In children, it may cause anemia, stunting, and reduced ability to learn. Although the effects are usually reversible with the treatment, the chronic cystosomiasis may affect the people's ability to work and in some cases can result in death. The number of deaths due to this disease is difficult to estimate because the hidden pathologies such as liver, kidney failure, bladder cancer, ectopic pregnancy due to genital uh, cystosomiasis. These are the hidden pathologies. We cannot actually quantify the burden. For the diagnostic purpose, I mean, the tools available here, the laboratory tests, we can have a clue about if there is a eosinophilia, but the definite diagnosis, the direct visualization of the cystosome egg via stool or urine microscopy. Egg morphology is the indicative of cystosoma subtype. Subtypes, there are typical features for each subtype. The Mansoni eggs have a prominent lateral spine, while hematobium, which causes urogenital somiasis, these eggs have prominent terminal spine, while Japonicum have a lateral spine. Further tests we can do is the imaging may be required to rule specific organ involvement, while detection of antigen in urine or stool sometime may be used to measure the treatment efficacy. Here is the picture of those eggs. I am in Sony eggs, as I told, have a spine on the side. Hematobium have a apical spine, and Japonicum are eggs are more round with the vague spine on the side. Cercaria, this is the third form of the egg before uh, by which the man gets infected. It's a fork-tailed circadian freshwater, uh, in the, and these are the forces by which they penetrate the skin and they travel through the venous circulation and eventually launch either the lung or portal circulation. They mature and reach the mesenteric veins. The, the species which reach there, I already mentioned that Japonicum and Mansoni, while for the Europe genital species is the Hematobium, where they live and ovulate for the duration of host life. More detail about Cercaria, the forked tail you can see at the end, and it's found in the freshwater and penetrate the human upon contact with the water containing it. How we can prevent this disease is depend all upon the prevention, and there is no vaccine available. The best way to prevent it, take the following measures like avoid swimming in freshwater where in the countries which shistosomiasis occurs, swimming in the ocean and in the chlorinated swimming pool is safe, while it's advised to have safe drinking water. Although shistosomiasis is not transmitted by swallowing contaminated water, if your mouth or lip come in contact with the water containing parasite, you could become infected because water coming directly from canals, lakes, rivers, streams, or springs may be contaminated with a variety of infectious organisms. And you should either bring your own water to a rolling boil for 1 minute or filter water before drinking it. Bringing your water to a rolling boil for at least 1 minute will kill any harmful parasite, bacteria, or viruses present, while iodine treatment wouldn't guarantee its safety. Water used for bathing should also be brought to the rolling boil for a 1 minute to kill any Cercaria and then cooled before bathing to avoid scalding. Water held in storage tank for at least 2 days are safe for bathing. Vigorous towel drying after accidental a very brief water exposure may help to prevent the parasite from penetrating the skin. However, do not rely on vigorous towel drying alone to prevent shistosomiasis. Here are some control measures which we can adopt, depend upon reducing the number of infection in pupil and eliminating the snails, which are, which are the intermediate host. These are required to snails are required there to maintain the parasite life cycle. So eliminating those snails is the other method to control them. For all species that cause shistosomiasis, improved sanitation could reduce or eliminate transmission. In some areas with low transmission level, elimination is considered a winnable battle by public health officials. Control measures can include mass drug treatment of entire communities and targeted treatment of school-age children. Some of the problem with control of shistosomiasis are there. Number one, chemical used to eliminate snails in freshwater. They may harm the other species in the water, or for certain species of parasite, such as Japonicum, animals such as cow or water buffalo can also be infected. And runoff from pastures can contaminate freshwater source. The eventual management, you can summarize it. Contaminated water should be avoided. Sanitary disposal of sewage, prevention contamination of water by feces and urine, destruction of snails, treatment of patients. Although there is no vaccine, but the drug of choice, or rather the only drug available for praziquantel, is effective against all species. This is a UN UNAID reference 2019, and which says that no more neglect female genital cystosomiasis and HIV. Uh, Female genital cystosomiasis is neglected tropical disease that affects most vulnerable communities, and it is currently underdiagnosed with grave implication for women's sexual and reproductive health. Women living with female genital cystosomiasis are at great risk of HIV infection and poor sexual and reproductive health. Female genital cystosomiasis can be prevented at low cost, and while the prevention and treatment of female genital cystosomiasis is an issue of social justice and sexual and reproductive health and rights. This is the latest, the article which I could find is of February 2021, last month article there, about schistosomiasis. What it says, uh, it highlights about the complications uh, of this disease. The complication can include female infertility and spontaneous abortion, increased incidence of STIs to include HIV, urinary tract obstruction, potentially leading to kidney damage, and end-stage renal disease and bladder cancer. Bladder cancer related to chronic urogenital cystosomiasis is the most common squamous cell carcinoma in comparison to transitional cell carcinoma, that is most common type of bladder cancer overall. Individuals with the cystosomiasis, including from hematobium, are the most susceptible to Salmonella typhi and other Salmonella species causing prolonged bacteremia. Chronic inflammation can also lead to subsequent issues to include anemia of chronic disease, malnutrition, and stunting growth. Enhancing healthcare outcomes is the message from this UNAID paper. The urogenital system is endemic disease causing a variety of chronic diseases, millions of people in Africa, Middle East, and easily treatable with praziquantel. Healthcare provider in non-endemic area must be also remember to consider this disease in evaluation treatment of individual presenting with acute and chronic symptoms who have previously traveled to endemic areas. And health professionals and organization initiation of community or school-wide mass treatment program in endemic area would considerably reduce the disease burden. Mass treatment of urogenital cystosomiasis may also be a cost-effective way to reduce HIV infection in sub-Saharan Africa. This is, another article, the key, I have mentioned here, the key points which the which is a consortium for operating research and evaluation about schistosomiasis, a group of people working on schistosomiasis, and they have come up with the key points about it in 2020. The biennial mass administration with praziquantel can control schistosomiasis to moderate level of prevalence, while mass drug administration alone will not achieve elimination, and to attain and sustain control throughout the endemic area, persistent hotspot need to be identified following a minimal number of years of annual mass drug administration and control through adaptive strategies. In annual MDA is more effective than the biannual MDA in high prevalence area, and that's the high prevalence area is the annual. That treatment is but while in biannual, we have discussed in the first one, it's said that the biennial mass drug administration can control to moderate level of prevalence. So in high prevalence is only the annual administration. The current World Health Organization threshold for decision making based on the prevalence of heavy infection should be redefined. The point of care, including circulating cathodic antigen urine analysis, are useful for schistosomia and SONI mapping in low to moderate prevalence areas. This is take-home message. We have talked about all of this. Infective form, you know that fork-tailed cercaria and the three forms, the terminal spine, lateral knob, or drug of treatments, the praziquantel. These are the references and the time for MCQs now. The three major species of schistosomiasis which cause the disease are?
Alpha.
A. That's the correct answer. How does a schistosome normally enter in the body?
B.
B. That's the answer. That's through the skin. What are the two major forms of schistosomiasis?
D.
It's D. It's intestinal and urinary. Yeah? Over time, what hazard can a certain form of
Bladder cancer.
It's C. Schistosomiasis affect the digestive organ. Which of the organ will not affect? Yes, heart will not be affected. Which of these is not a symptom of schistosomiasis? Sneezing is not associated with it. But is schistosomiasis fatal to human victims?
Rarely.
It's sometime there. Why is common name of schistosomiasis nail fever?
A.
D.
You say if it goes in the tiny snails. How long does it take to enter the body?
B.
A.
It should be 30 to 60 seconds. The last one, which is the drug of choice for all?
Praziquantel.
That's the key. At the end, I have mentioned the forms stadium, area,
Thank you, Dr. Daud, for a comprehensive presentation. Schistosomiasis is caused by parasitic worms. Lack of hygiene, swimming, and agriculture workers are at high risk of developing the disease. The control of disease can take place in large-scale population. Treatment with praziquantel is given using potable water, adequate sanitation, and snail control. What is the status of Pakistan? I have a question. What is the status of Pakistan regarding this disease? Anyone from the class? This disease is not endemic in Pakistan right now, but few cases have been reported. But this is still not endemic. Thank you.
Thank you so much.